nearly 47 million Americans exposed to health risks from fossil fuel infrastructure. A new study reveals that approximately 47 million Americans, 14.1% of the U.S. population, live within a mile of fossil fuel infrastructure, raising concerns about potential health hazards. The research, published in Environmental Research Letters, highlights the widespread exposure to pollutants across the entire fossil fuel supply chain, from extraction to end use. The hidden reach of fossil fuel infrastructure for decades, public awareness of fossil fuel risks has centered on visible elements like oil rigs and power plants. However, the full picture includes a sprawling network of refineries, storage facilities, and transportation hubs often overlooked. This study breaks down the exposure across 5 stages: extraction, transportation, refining, storage, and end-use facilities. The researchers found that nearly 21 million people live near power plants end use, while over 20 million reside near oil and gas wells, extraction. Storage facilities, including underground gas storage and petroleum terminals, expose over 6 million residents. Many communities are exposed to multiple infrastructure types, meaning the total number of affected individuals is higher than the sum of each stage. Disproportionate exposure and environmental injustice, the study confirms a stark reality. Exposure to fossil fuel infrastructure is not evenly distributed. Predominantly non-white communities bear a disproportionate burden, aligning with existing research on environmental injustice. Urban areas are also more heavily exposed, with nearly 90% of the affected population living in cities. This disparity underscores the need for targeted interventions. Researchers suggest that policymakers in urban areas may achieve the greatest impact by focusing on storage facilities, which expose a higher density of residents per facility compared to extraction sites. New insights. The study's findings were made possible by the launch of the Energy Infrastructure Exposure Intensity and Equity Indices (EI3) database for public health in 2024. This first-of-its-kind database centralizes publicly available data on fossil fuel infrastructure, previously scattered across various agencies and jurisdictions. The team made the dataset accessible on Harvard Dataverse, removing barriers to research and policymaking. Uncharacterized hazards in future research. The study identifies critical knowledge gaps regarding the hazards imposed by mid-supply chain infrastructure. While research confirms health risks near extraction and end-use facilities, including adverse birth outcomes and asthma, the effects of living near refineries, storage facilities, and transportation hubs remain largely unknown. Researchers emphasize the need to characterize these hazards and identify vulnerable populations. Future studies should monitor air, water, noise, and light pollution near facilities, leveraging datasets like Medicaid claims and pregnancy planners to assess health impacts. Policy implications. The study challenges the assumption that fossil fuel processes are adequately regulated. In many regions, facilities operate with minimal zoning restrictions, allowing them to be built in close proximity to homes and schools. The findings call for stricter regulations, equitable siting of new infrastructure, and targeted interventions to protect vulnerable communities. The research underscores a critical message: the health risks of fossil fuels extend far beyond visible pollution. Addressing these risks requires comprehensive data, rigorous research, and a commitment to environmental justice.